Each workshop also includes an evaluation form you can ask participants to fill out at the end of each workshop. These short surveys include 8 questions specific to each workshop and take less than 5 minutes to complete. This information can be used to assess the impact of the workshops in your community by providing useful information on participant satisfaction with the overall workshop and instruction, as well as specific workshop components, including the activities and handouts. These evaluations were used successfully as part of the pilot program to test the workshop series, which I will speak about in a few moments. Before releasing the community workshops last spring, pilot testing was conducted at 10 sites across the country. The goals of pilot testing were to assess the usability of the workshop to communicate key recommendations from the Dietary Guidelines for Americans and the Physical Activity Guidelines for Americans to adults with varying levels of health literacy in a variety of settings. Also, pilot testing was used to evaluate the effectiveness of the Eat Healthy, Be Active community workshops in increasing participant knowledge and motivation to change eating and physical activity behaviors. Last fall, pilot testing was conducted at 10 locations across the United States, representing diversity in both audience and geographical location, as you can see on the slide here. The workshops were taught sequentially over a 3-month period in a variety of settings, including cooperative extension, worksite wellness programs, faith-based organizations, and parent groups. Workshop participants consisted of adults from a variety of social, economic, and educational backgrounds. Our office, the Office of Disease Prevention and Health Promotion, and a contractor provided guidance and instruction prior to, during, and after completion of the workshop series through phone and email contact to the instructors. Additionally, a stipend was provided to supplement the cost of purchasing food for taste testing and demonstration of the workshops. Several evaluations were developed to assess the usability, satisfaction, and effect of workshops on eating and physical activity behaviors. Qualitative and quantitative data were collected from both workshop participants and pilot site coordinators through oral and written evaluations. Participants completed a survey prior to Workshop 1 and the same survey after Workshop 6 to assess knowledge and motivation to make changes. In addition, participants completed the evaluations found at the end of each workshop in the series, which I spoke about earlier. Instructors completed a SurveyMonkey questionnaire following each workshop and a longer survey at the end of each series, at the end of the entire series. We also conducted follow-up phone interviews to discuss in detail the feedback provided on the questionnaire and to better assess instructors' experience teaching the workshop series. Some of the data collected from pilot testing will be presented on today's webinar, and the information collected from pilot site instructors was also utilized to compile a best practices document to highlight successful implementation of the community workshop. The best practices for implementation document is available on our Dietary Guidelines website. These next few slides will highlight some of the information collected from pilot testing. The overall conclusion from pilot testing was that the Eat Healthy, Be Active community workshop series is an effective, action-oriented educational tool that can facilitate achievable individual behavioral changes. Overall, the majority of participants, over 90%, found the workshop content to be useful and the accompanying activities and handouts to be helpful for adopting the target behaviors. We also encourage participants to share testimonies of their experiences and received this quote from one participant. "I would like more programs like this in the future, please. I gave the sheets to my dad who had a heart attack in November. He actually read them, and he talked to me about them." On average, after attending each workshop, more than 90% of participants reported a willingness to change the specific behavior emphasized in each workshop. As you can see, the percentage is lower for Workshop 6. Physical activity is the key for living well on this slide. This is because the particular question asked was focused on nutrition behaviors. However, it's encouraging to see that after a workshop more focused on physical activity, 85% of participants also plan to make eating behavior changes. When we asked specifically about plans to become more active after Workshop 6, 97% of participants reported that they plan to become more physically active as a result of attending that workshop. After attending at least one of the workshops, 2/3 of participants reported changing their eating habits or physical activity behaviors. Nearly every individual who noted they had made changes attributed these changes to attending at least one of the workshops, as you can see from the figure on the slide. Here's one quote from a participant. "After coming to the workshops, I'm changing the way my family eats. I pay more attention to the food labels and to continue to exercise as much as possible." Pilot site instructors provided feedback that we used to improve the workshop series prior to release last spring. For example, several instructors asked about the possibility of having the materials in Spanish. We are pleased to release Spanish versions of the handouts for each workshop, which are available on the Dietary Guidelines website. Food safety information was included in the workshop, but one site suggested adding some additional information into the appendix, which we did. The feedback from the pilot site instructors was also valuable in compiling the best practice tips for implementation. Also during pilot testing, we had the handouts within the workshops occurring after the related talking points. Several instructors suggested that we place the handouts at the end of each workshop, which would help them to plan ahead and ensure photocopies were made of each handout prior to the workshop. The workshops were designed to be used by a variety of community leaders and educators, even those without a nutrition degree. Although many of the pilot site instructors were dietitians or had previous experience with nutrition information, you do not need a nutrition background to teach the Community Workshop series. However, we strongly recommend, no matter what your background is, that you thoroughly review the workshop concepts, lesson plan, and content. You can also use the appendix to find additional useful resources and information. Another item we learned from pilot sites was additions to the planned activities contained in the community workshops. A few pilot site instructors suggested playing music during the muscle strengthening activities found in Workshop 6. As you can see on the slide, this is an image of one of the handouts from Workshop 6, which gives detailed step-by-step instructions on how to teach participants how to do the activities, as well as a guide for participants to try these activities at home. They also suggested playing music during the brief stretch breaks midway through each workshop. We encourage instructors to tailor workshops to meet the needs or interests of your participants by adding resources or materials that may help them understand or adopt a particular behavior. For example, we already know of one faith-based site who is currently teaching the workshops with an emphasis on weight loss. They had participants weigh in on the first day, and instead of starting with Workshop 1, they started with Workshop 4, Top Tips for Losing Weight and Keeping It Off. This helps set the foundation for their program, and then they continued teaching the workshop series sequentially. In the appendix, you'll find additional handouts and tools you can incorporate into the workshop lesson plan to suit the needs of your audience. Unfortunately, the videos were not completed in time for pilot testing, but many pilot testing instructors indicated they thought a short video would add to the workshop. We're pleased to announce that the videos are available for download from the Dietary Guidelines website, in addition to the handouts that I've mentioned and the complete full series of the workshop themselves. And finally, one of the last things we learned from some of the pilot sites was to consider making the last class after Workshop 6 a celebration to show your appreciation for the group's participation in the Community Workshop series. One pilot site created a certificate to award participants with the completion of the series. We loved her idea and included a certificate of completion in the final series, as you can see here on this slide. This is in PowerPoint form, so you can easily type in the name and date of when you're completing the series and give this to participants at the end of the series. Also, to make the last class more of a celebration, you may choose to try a new recipe or bring a different food to try. One instructor, who you're about to hear from next, made yogurt parfaits with yogurt and fruit for everyone at the last class. And with that, I'd like to introduce Sarah Burkett, a Senior Extension Agent with Family and Consumer Sciences in the Virginia Cooperative Extension. Sarah was one of our excellent pilot site instructors and is going to speak about her successful experience pilot testing the community workshops